Our today's topic of discussion is depression. You must be wondering why we are discussing depression today. Is it so important? The answer is yes. It is very important to discuss depression, because it is not only a common mental disorder but also it adds to the risk of suicide. Yes, you have heard it right. Depression can lead to suicide. According to WHO, 5% of adults suffer from depression. Around 7 million people across the globe die every year due to suicide. Females are more commonly affected. So without wasting our time, let's look. What is depression? What are the clinical signs and symptoms of depression? What are the differences between depression, anxiety and stress? How to deal with depression? When to take medical help? What are the barriers in the treatment of depression? Depression in simple words means that an experience where you feels down, which is often called low mood, and when you have lost interest in things which you used to enjoy. Let's see. What are the clinical signs and symptoms of depression? There are two types. One are psychological symptoms that are related to your mind. The other ones are biological symptoms that are related to your body. Psychological symptoms include low mood, reduced self-esteem, pessimism, guilt, loss of interest, suicidal thinking, loss of enjoyment. Biological symptoms include reduced appetite, reduced weight, decreased or disturbed sleep, fatigue, loss of libido, bowel disturbance, motor retardation, slowing of activity. If you are facing these symptoms, then that is the right time to visit your doctor. You must be wondering, what are the reasons for depression? Let's discuss them. Number 1 is genetics. That means depression tends to run in families. So if you are facing depression, then it might be possible that any of your family member is going through the same. So take care of them too. Next is personality. It is believed that certain personality traits are responsible for depression. Next cause is early life environment. For example, people not having healthy relationship with their parents tend to suffer more from depression. Any other life difficulties like joblessness, physical illness also increase the risk of depression. How depression is different from stress and anxiety. Anxiety is a sense of fear that something terrible is going to happen. Stress is a sense of feeling overwhelmed, maybe due to under pressure for too long. We all have heard a term postpartum depression. Let's look what is that? Postpartum depression is a complex of physical, emotional, and behavioral changes that happen in some women after giving birth. For the treatment of depression, your doctor will be prescribing you antidepressants, psychotherapy. So visit your doctor without any delay. You will be surprised to hear that despite depression is curable, 75% of patients in low and middle income countries don't take any medical advice. There are different kinds of barriers which include financial problems, lack of awareness, lack of healthcare services, social stigma of mental health conditions. Our next video will cover the topic that how to know that am I depressed or not. So if you have not subscribed this channel, then do it now. And press the bell icon too. Thanks for watching.